Hello, my name is Corrado Sandini. I studied medicine at the University of Geneva in Italy, where I was born. And ever since med school, I was really fascinated by the study of the brain and by the hope that by better understanding the brain and how it develops, we might be able to better understand and also treat complex psychiatric disorder, such as attention deficit hyperactivity disorder or schizophrenia. This is why, after med school, I decided to pursue a PhD in the field of psychiatric neuroscience at the University of Geneva, under the supervision of Professor Stéphane Eliès, and I was supported by the NCCR SNSF. During the first part of my PhD, my objective was to understand how the development of brain networks predisposed individuals to the development of complex psychiatric disorders, such as schizophrenia. However, rather quickly, I also became fascinated with understanding the behavioral complexity of mental health problems. In particular, what I found fascinating was understanding the origins of psychiatric comorbidities, meaning the fact that when a patient has criteria for single mental health problems, such as ADHD, in more than half of the cases, he will actually have criteria for at least another and sometimes even 3 or more mental health problems at the same time. I think this is interesting because it challenges the assumption that different mental health problems have independent sets of causes and underlying mechanisms. What I was able to show during my PhD is that if we used sophisticated network analysis techniques, we could actually predict the development of comorbidities as a result of interactions between symptoms of the different disorders. So for instance, children who have anxiety are predisposed to later lose their ability to tolerate minor daily stressors, which is then a risk factor for the development of psychosis. I find that this idea that mental health problems are complex systems of interacting symptoms is extremely powerful, because it means from a clinical perspective that we might be able to personalize clinical care, not only in respect to the intensity of symptoms, but also in terms of what we know of how symptoms have interacted with one another. Indeed, nowadays, from a clinical perspective, when we are faced with a patient with comorbidities, we really have no way of deciding which of the different difficulties we should treat first and prioritize. Indeed, understanding how symptoms interact with one another is really difficult with the assessment tools that we currently have at our disposal, which really give us only a static view, similar to a picture, of which clinical difficulties are present at a given moment in time. I was therefore fascinated by the research conducted by Professor Maud Schneider at the Department of Psychology, who was using digital phenotyping and specifically smartphones to administer questionnaires in the daily life of patients. When we applied network analysis to this dynamic data, we were able to show that we were actually in the ability to dissect networks of how symptoms had interacted with one another in individual patients. However, what we also realized that a key information that we were missing was the role of sleep. Indeed, having specialized in sleep medicine, I realized that sleep is a key contributor to mental health problems, but that oftentimes we are really not able to understand whether sleep difficulties are more a cause or more a consequence of mental health problems. This is particularly an issue in attention deficit hyperactivity disorder, and specifically during adolescence. This is why a key objective of the proposal is to use digital phenotyping techniques in adolescents who suffer from attention deficit hyperactivity disorder. And we will measure not only core symptoms of ADHD using neurocognitive games, which allow us to measure attention, but also symptoms of emotional difficulties using questionnaires, and sleep as it fluctuates from one day to the next using smartwatches and also a portable EEG. Once adolescents with ADHD are recruited in the study, they will be followed up longitudinally after 6 months, during which time we expect that most patients will have been treated for their ADHD. Using network analysis techniques, we aim at developing signatures of how symptoms have interacted with one another, and we believe that these signatures will be important in helping us predict why patients actually respond quite differently to similar treatments. This project will begin in January of 2023 and has been supported by the Swiss National Science Foundation with an Ambizione grant. So I would first of all like to thank the SNSF for their confidence and support in the project. I would also like to thank the NCCR SNSF who has supported my research until now, and the many PIs who have inspired my research and this proposal, including Professor Stéphane Eliès, who will host the proposal, Professor Dimitri van de Wil at the PFL, who has inspired the analysis techniques that I have developed, and Professor Maud Schneider.